All right. I'm going to go boy, girl, just to make sure everybody knows I'm fair here. Right here.
Hi, my name is Jeanette McKenzie,
Uh-huh.
and my mother lives with my husband and I. We take care of her. She's been with us for 6 years now. She is currently in a nursing home getting rehab.
Right.
I have great concerns over your health bill.
Mm-hmm.
One of the ladies in admissions over there, whom I was talking with the other week, she's from England, and her family is still in England.
Right.
And she was explaining to us telling us what we had to look forward to here. Her sister worked as a nurse in the same hospital for 20 years. She was 55. She was told she needed open heart surgery. She was put on a 10-year waiting list. 3 years later, she had a major heart attack, and they were forced to give her that surgery that she needed.
Right.
I realize you're saying, the 26-year-olds will have health insurance. They don't have to worry about that.
Right.
My mother always told me, the older you get, the faster time goes. And when she said that to me years back, I thought she was crazy.
Yeah, I've noticed this too.
Yeah. And these 26-year-olds in a heartbeat are going to be 50,
Right.
55. When you're young, you're supposed to be able to work hard for what you want. You build up your income. You further yourself so you can retire and have peace of mind.
Right.
It's hard to, I can't fathom now, how can you be excited in your youth when you have to save just to protect yourself health insurance-wise when you reach our age?
Let me ask you a question, though. Because you said you're worried about my health reform bill, and the nurse said, here's what you have to look forward to. Is your mom on Medicare?
Yes.
Yeah. So
Yeah,
there's nothing in our health reform bill that is going to impact whether your mom can get heart surgery if she needed it. We didn't change the core Medicare program. So unless there's something specific that you're worried about.
Medicare doesn't start until you're 65.
No, I understand. Right.
I'm talking about 50, 55
Okay.
years old.
All right. So if you're not on Medicare,
yes, right.
and do you have health insurance?
Yes, right
Okay.
now, yeah.
Right. So there's nothing in the bill that says you have to change the health insurance that you've got right now. I just want to identify what your worry is, because I want to say you shouldn't be worried about it. But what is it that you think might happen to your health insurance as a consequence of health care reform?
Okay, what I'm concerned about is, just say if my husband got laid off.
Right.
Say we had no health
You had no health insurance.
care insurance. Okay.
Now, right now, before reform, if you had no health insurance, you'd just be out of luck.
All right.
Okay.
And then we get the government-run health insurance, right?
Well, no.
Is that what you're saying?
Here's the way it would work. So let me just kind of map it out for you. If you are already getting health insurance on your job, then that doesn't change. Health insurance reform was passed 6 months ago. I don't know if anybody here has gotten a letter from their employer saying you now have to go into government-run health care because we can't provide you health insurance anymore. I mean, that hasn't happened, right? So you're keeping the health insurance that you had through your job, and the majority of people still get health insurance through your job. The only changes we made on people's health insurance who already have it was to make it a little more secure by saying there's certain things insurance companies can't do, a patient's bill of rights, basically. So insurance companies can no longer drop your coverage when you get sick, which was happening. Sometimes there were some insurance companies who were going through your policy when you got sick to see if you had filled out the form wrong, you hadn't listed some infection that they might call a pre-existing condition, etc., a bunch of fine print that led people not having health insurance. So that was one thing that we said. We said also you can keep kids on your health insurance till they're 26. That children with pre-existing conditions had to be covered under health insurance. So there were a handful of things that we said insurance companies have to do, just as good business practices to protect consumers. But otherwise, you can stay on your employer's health care. So that's if you have health insurance. The other thing we did was we said a lot of people who don't have health insurance is because they work for small businesses who have trouble affording health insurance because they're not part of a big pool. They're not like a big company that has thousands of employees and they can negotiate because the insurance companies really wants their business. So what we said was, let's provide tax breaks to small businesses so they're more likely to buy health insurance for their employees. And right now, about 4 million businesses across the country are now getting a tax break, a tax credit if they provide health insurance for their employees that can save them tens of thousands of dollars. So that's the second thing. And the third thing we said was, okay, if you don't have health insurance, just say your job doesn't offer you health insurance or you lose your job, then what we're going to set up is what's called an exchange, which is basically a big pool. You become part of this big group of people, just like as if you were working for a big company or a big university like Drake. You become part of this pool, and you'll be able to buy your own insurance through this pool, but the rates will be lower and you'll get a better deal because you've got the bargaining power of these thousands or millions of people who you're buying it with. You'll still have a choice of plans. You'll have a choice of Blue Cross, or you'll have a choice of this plan or that plan, but you'll be buying it through a pool. And if you can't afford it, then we'll provide you some subsidies to see if we can help you buy it, so make it affordable. So that's essentially what health reform's about. Now, what that means is that you're not going to be forced to buy a, quote, government-run health care plan. The only thing that we have said is that if you can afford to get health care and you're not getting health care, well, that's a problem because that means when you get sick and you have to go to the emergency room, everybody else here has to pay for it. And that's not fair. So we've said if you can afford to get health care, we're going to make sure that you can afford it, but you've got to have some basic coverage so that we're not subsidizing you. Everybody else isn't paying an extra $1,000 on their premiums to cover you.
All right. We all agree there needs to be health reform. Okay. Right. We just moved out here a year ago from Las Vegas.
Right.
Okay. There are illegal immigrants that are getting free health care right now. Okay, the doctor, we had clinics and stuff close up because they couldn't even afford to stay open because of all the illegal immigrants that were getting health care.
Well, let me do this because I'll answer this question, then I want to make sure everybody else gets a chance too. But I think this is important for me to be able to clear up some stuff. There's no doubt that there are probably, a number of hospitals in every major city, doctors in every major city, who are providing uncompensated care to a whole lot of people, including some illegal immigrants. I mean, basically, most doctors and nurses that I meet, their whole reason for being in the profession is to help people. And so if they see somebody coming into the emergency room, if there's some child who's badly injured or sick, they're going to not check on their immigrant status. They're going to say, this is somebody who needs help. And I think that's the right thing to do for our society generally. I think it is very important for us to make sure that we have compassion as part of our national character. Now, the thing I want to point out, though, is that, first of all, there's nothing in my health care plan that covers undocumented workers, right? So that's not part of health reform. And the second thing is, it turns out actually illegal immigrants probably underutilize the healthcare system. The only time they go to the healthcare system is if they have an emergency, because, for the most part, they're worried about getting caught. So that's not to say that there's not a portion of that population that is getting uncompensated care that's adding to our costs, but there are a lot more Americans who don't have health insurance. As a consequence, don't get regular checkups, aren't getting preventive care, are more likely to end up in the emergency room, are more likely to add to the costs of the hospitals or the doctors. And so if we can provide them with basic checkups, basic preventive care, affordable health care, so they've got some peace of mind, that will actually, over time, make the system more efficient as a whole, because emergency room care is the most expensive kind of care. But I guess the main message I just want to communicate, because there was a lot of misinformation during the health care debate. I just want to communicate that if you're happy with what you got, nobody's changing it. And you and your mom are going to be able to have, your mom is going to have her Medicare, and the core benefits of Medicare aren't changing. And if you've got health care through your employer, that's not going to change, except to make it a little bit safer and more secure. If you don't have health care, then it's just going to help. And overall, independent estimates say that this is not going to add to our deficit. It's actually going to reduce our deficit, because we're making the healthcare system more efficient over time. But I understand why people are concerned, because this is a very personal thing, and nothing's scarier than when you don't have health care and you're sick. I've told the story of when Sasha was 3 months old, she got meningitis, and I still remember going to the hospital, and she had to get a spinal tap, and I never felt so helpless and scared in my life. And I was lucky to have health insurance, but we were in the emergency room looking around and thinking, well, what if I was one of these other parents who didn't have it, and my daughter was going through this? And I was thinking, I'm going to get a $20,000 or $30,000 bill after this, and I have no way of paying for it. Or what if my child has a chronic illness? And so it's not just a one-time trip, but it's trip after trip. And I don't think any parent should have to go through that, not in a society as rich as ours. So, but thank you for the question. It's helpful. Yes, sir.